Hi guys, it's still your favorite scientist, Lovely. Okay, last week I was going through an online clip where I came across this particular video of Dr. Afoko where he was talking about the proper way of treating malaria. There was something he said in the video that really caught my attention. Just pay attention to it.
If you want to treat malaria properly, watch this video. Because some of you are treating nonsense, that's why the malaria is not going. First of all, you need to understand that, for example, now this one, chloroquine, if we are scoring it on how effective it is at treating malaria alone, 39%, that's failure. This one, S&P, if you are scoring it by say 56%, it passed but it not pass like that, meaning that it's not effective enough. These other two, this one is artesunate injection, this one is artemether injection. If you use them alone by themselves, they work, very effective. But here's the problem. They just go in, but their half-life is very short. In other words, they're like 2 minutes men. They are done, and the parasites will continue to grow again, which is why the federal government has said that in Nigeria currently you cannot use any of these drugs by themselves to treat acute uncomplicated malaria. As you are trying to kill the malaria parasite is also trying to kill you. So in other words, it's adapting, it's becoming resistant, because some of you are just abusing drugs. You will just have small fever like this, you think it's malaria, you go and treat it, meanwhile it's not malaria that is doing you. Which is why one of the best drugs to actually treat malaria is artemisinin combination therapy. In other words, they combine artemisinin based drugs with some other drugs, as the malaria parasite is avoiding this one, is collecting from the other one. That's how it's supposed to be. You never even give the malaria parasite chance to rest. It's combination therapy. Monotherapy by itself is useless. And finally, before you treat malaria, please test.
So in this video he said, before any treatment, make sure you run a test. Before any treatment, make sure you run a test for malaria. For most of us engage in practices like this where slight headaches and fever will assume it to be malaria, not minding the side effects of the drug, increasing the rates of drug resistance, unnecessary medication, and so on. So I'm advising us, before treating any malaria, make sure we run the test. In most lab is not expensive, so what's there running the test before treatment? You appreciate me for this when you start running tests before treatment.